I'm here in my friend and colleague DJ. Well, she has lots of names and she can introduce herself with all of her names, but she is a friend who works with the students, the clients that we work with eating disorders, among other things. And we're going to talk today about why she does what she does, how she does it, and then hopefully we're going to record some of how it actually looks when you're actually doing the practice with these clients, hopefully. And you can learn and I can learn too, and hopefully do some of this stuff even with our clients if it's okay with you when I'm working with them.
Sure.
So yeah. So can you say a little bit about who you are?
So first of all, it's very nice to be here with you.
Yeah.
Finally.
I know.
And so the work that I do is called yoga therapy, and not a lot of people know about that, so maybe it's helpful to talk a little about it. So yoga therapy in Sanskrit is yoga chiksa, and it's an ancient use of yoga to treat and heal the human being. So basically it's healing all the levels of the human being: physical, the level of the personality, the mental level, the energy level, and the spiritual level. So one can manifest all that one came here to manifest. And in the specific work here, I use yoga therapy for a number of conditions. And in the realm of eating disorders, I get to use all of the conditions, all the uses of yoga therapy, most of them, because we are dealing with digestive disorders, we are dealing with cardiac problems, we're dealing with so many physical bone problems. So aside from the mental issues, usually there is so much into the eating disorders too. Besides the eating disorders itself, there is depression, anxiety, OCD, bipolar. So it's a lot of use of yoga therapy here. So it's really the treatment. And treatment is not a good word, because treatment creates the idea that there is the doctor and the patient. So it's really like a co-work where basically I encourage the student to be everything that she is, but it's kind of hidden with all these layers of trauma or just karma or whatever's going on there. So we unlayer those, we peel these layers so just she can or he can flower and blossom. So the work here is very organic, very individual, very systematic, not very whole. There's no one thing, not just the knee, just the stomach, just the mind. It's the whole person.
That's a great explanation. And when you're sitting with new folks who come to see you, you sort of tell them that a little bit, or in a different, maybe a different language, but to help them understand.
What I tell them is usually, yoga is one of the technologies, one of the main technologies. The same way therapy is one of the technologies, because not everybody is going to feel comfortable doing yoga, especially for folks with eating disorders. It can be very intimidating because it is the embodiment. It's everything they don't want to deal with. So it has to be done in a very safe way. So yoga is one of the many technologies available to heal oneself. So yoga takes one gently by the hand to take one back to oneself. So that's usually how I explain.
And when you have clients, because you're talking about all the different things that can go along with eating disorder or certain often what sort of creates the space in which an eating disorder can bloom and grow. When you talk about trauma, I'm really curious about, and hopefully we'll talk more about this, but how if you have clients who've had significant sexual trauma or other kinds of body trauma, what you notice about that, how you might work differently with somebody with those issues, in addition.
So that's another aspect why eating disorders in the context of yoga is better taken care of individually, because I've taught many students in group settings, in hospitals, in treatment centers, where there were a lot of people in one room, which is doable, which I'm sure they collect the benefits, but it's so individual. There isn't one eating disorder. And even the one eating disorder is such a very wide spectrum. So when they come here with some sort of sexual trauma, we have to be especially careful not to reactivate that trauma. And there is touching in yoga. It can be easy when we adjust, sometimes if I'm doing energy work. So I always ask. I ask the students in the beginning if they are comfortable with touching and how much, and they can always tell me. And before touching, in any situation, I always ask if that's okay. I ask directly to the person, but also in other levels. I just sit there and ask for us to be in harmony. So I breathe together with the student, so I observe how her belly is moving. So and I try to sync my breathing with the student, so we are breathing together, and that creates this.
Yeah, it's so great to be talking with you about this, because one of the things we will be talking about in class is all these other ways that we can access and work with folks with eating disorders. But I think the thing that often has felt the most just powerful to me is when we're able to connect the body, because as you said, there's just so many pieces. It's not just about it's about everything. It's about the whole picture of what's inside and out that's going on. So you have to be with and be mindful. Although that's something, as I know, I'm sure you've experienced too, it's like so scary for our clients to even get close to sometimes. I've had clients that I've wanted to send you, I think I've talked to you about some of these people, but who, like in my office, if I can get them to even for say 10 seconds, I literally had to time it for 10 seconds for this one client. I remember to just have her hands touching like her legs so that she could feel her body. I mean, it was almost intolerable for her to do that. It's kind of amazing.
And we have one pivotal breathing in yoga, which is diaphragmatic breathing, which we breathe like this. So you put your hand on your belly button, and this area can be very sharp, very traumatic for the person to touch. There's so much self-hatred in the sacred area of the belly, right? So, and I have to say, I never had any problem with a student touching their belly, exception maybe one student who was hesitant, but she didn't. But I would say there are always ways around it, so we have to be creative about it. So sometimes I just say, use a pillow here to start, and you can feel the movement, because it's very important to feel the movement in, and the belly goes out when you inhale, and when you exhale, the belly goes inwards. And that's the baby breathing. I tell them, like, homework, grab a baby and watch the belly moving.
That's true.
And I tell them, that's how you were born breathing. You were born perfect. You're born beautiful. You're born destined to be happy. But we forget, and we start breathing from the chest and become so anxious. And so the breath has this healing power of connecting with who we truly are. Right? And going back to trauma issues that you're asking, when the person goes to a sort of trauma, that gets registered in the very cellular level, and it gets registered with the breath. Now when you get a shocking news, you go, and that gets stuck somewhere in you. So with a number of specific techniques, we can bring that to the surface and release that through your own breath. And I joke with my students that the breath is never on vacation, never cancels a meeting, right? It's there with you 24/7, so you can always count on it. So it's a very powerful tool in yoga therapy, the work that I do.
Yeah, that's great. I was going to ask you also a little bit, I mean, we could talk about cases that we're sharing now, or other cases where you feel like, I was sort of thinking about like this most successful, or how you would determine like a client maybe who came in and maybe was really hesitant about it, or most people like it's like voodoo, or it's
because they don't know. They sit here with me and they're like, what the hell we're going to do?
We're going to breathe? Huh?
Or we're going to be in the body.
What the hell does that mean?
So it's very specific. Again, I have students who just talk the whole session. And I have students who just spend time on the yoga mat. And I have students that it's everywhere in between. So, and depends on the day too. So I allow the work that I do to be very spontaneous. I create a program, so just going back on how kind of my system works. So we meet for the first session. We sit here. Beforehand, I have a questionnaire that I have my students